Hello, my name is Gerald Prieto, and this is my presentation on supporting students with extra abilities with autism spectrum disorder and specific learning disability in reading in grades 4 through 8. What inclusion education means. Inclusion is more than just placing students with disabilities in a general education classroom. It is about helping them feel like they belong. When students feel seen, valued, and understood, learning naturally follows. True inclusion also means working together with special educators, paraprofessionals, and families to make sure supports are consistent. Fairness doesn't mean giving everyone the same thing, it means giving each student what they need to succeed. And of course, all of this must be done ethically, respecting FERPA and protecting each student's right to privacy. What is autism spectrum disorder, or ASD? Autism spectrum disorder is a developmental condition that affects communication, social interaction, and behavior. It is called a spectrum because no two students experience it the same way. For example, student 1 might have a remarkable memory and excel in structured academic tasks, but struggle with unstructured social time. Many students with ASD also have deep interest in specific topics, which we use as motivational tools. Understanding these unique patterns help us individualize instruction and reduce frustration. When we create structure, predictability, and visual supports, students with ASD feel safe and ready to learn. Autism, prevalence and causes of ASD. Autism is one of the most common developmental disabilities we see in schools. According to the CDC, about 1 in 36 children uh, is diagnosed with ASD, which means most teachers will teach at least one student on the spectrum in their career. While research suggests both genetic and environmental factors play a role, what matters most in schools is how we respond. Early identification and consistent support help students develop communication and social emotional skills. As teachers, our job is to provide structured routines, calm environments, and predictable transitions that reduce anxiety and make learning more accessible. ASD in daily life and friendships. For many students with ASD, the school day can feel unpredictable and overwhelming. Student 2, for example, might become anxious when schedule change or noise level rises. These students often prefer routines and may find group work challenging because of social demands. However, they also bring wonderful strengths such as honesty, reliability, and focused attention to detail. Teachers can help by explaining changes ahead of time, using visual schedules, and fostering a classroom culture that celebrates differences. Teaching peers how to be inclusive and patient helps all students grow in empathy. Supporting students with ASD. The best strategies for students with ASD are structured, visual, and consistent. For instance, student 3 might benefit from a first then board or a calm corner for self-regulation. Teacher, Teachers can teach social expectations explicitly through modeling and guided practice rather than assuming students will pick it. Giving sensory breaks, visual cues, and positive feedback helps students stay engaged. Just as importantly, celebrating their passions like math, art, or technology builds confidence and fosters connection. When the classroom feels safe and predictable, students with ASD can truly flourish. Now, what is specific learning disability in reading? A specific learning disability in reading, which sometimes is called dyslexia, affects how a student processes written words. It is a neurological difference, not a lack of ability or motivation. So, for example, student 4 might have an excellent ideas and oral communication skills but struggle to decode or spell words. Recognizing these students' creativity and verbal strengths can make a huge difference in their confidence. They often do well with multisensory instruction using touch, sound, and movement to reinforce reading skills. When teachers pair evidence-based reading programs with patience and encouragement, these students often make steady progress. Prevalence and causes of SLD in reading. Reading disabilities are quite common. Studies suggest they affect 5 to 15% of students in school populations. Many cases are linked to how the brain processes phonological information, meaning that decoding sounds into words is difficult. The earlier we identify and address these challenges, the better. Using progress monitor tools and partnering with reading specialists helps us track improvement. For example, student 5 might start to enjoy reading once we match the right intervention with engaging, accessible materials. So collaboration and communication with families is key to long-term success. How SLD in reading impacts learning and confidence. Students with reading disabilities often experience frustration and embarrassment, especially during read aloud or timed tests. So, for example, student 6 might have excellent comprehension when listening but struggle to decode independently. That mismatch can affect self-esteem. Teachers can help by creating a judgment-free environment, allowing audiobooks or voice-to-text tools, and celebrate progress rather than perfection. Encouraging peer empathy, reminding the class that everyone learns differently, helps remove that stigma. We, when we be, when we focus on growth, not grades, students begin to see themselves as capable learners again. Strategies for supporting SLD in reading. Structured literacy programs like Orrington Gillingham are highly effective for students with reading disabilities. These lessons use a step-by-step, multisensory approach. Students hear, see, and touch the words they are learning. So, for example, student 7 might benefit from color coding syllables or tracing sight words in sand. Beyond academics, we can boost confidence by praising effort, not speed, and giving flexible options for demonstrating learning. Whether it's through art, discussion, or technology, celebrating small wins makes students feel capable and proud. Ethics and collaboration. Ethics and professionalism are the foundation of inclusive teaching. FERPA reminds us that student information, like diagnoses or accommodations, must stay private and only be shared with authorized staff. When we discuss students, we should always be respectful, strength-based language. Instead of saying a struggling reader, we might say a student who benefits from reading supports. Collaboration with specialists and families ensures we are all working toward the same goal, which is helping each student feel valued and capable. When we combine compassion with professionalism, we model respect for every learner. And then here are my references.